One of the most common questions patients have when they first come to my office is, can I be cured of this illness? And this is a difficult question because right now, with our state of diagnosis, maybe very late in disease, most studies show that patients who come to a specialist's office have a very low likelihood of cure from their illness. Now, this may change when we are better at diagnosing this illness early, or when we develop other tools for treatment. But as it stands now, the focus is not on cure. But I want to say that management, adaptation, gaining stability and trying to improve can be accomplished with good supportive care. So patients should ask not, can I be cured, but am I doing everything possible to adapt and to treat my symptoms and to achieve stability and maybe small increments of improvement? So right now, we don't really have any direct curative treatments for ME/CFS, but don't underestimate the benefit of skillful management. So I can tell you, and I think my patients would tell you, at least where I practice medicine, we have many tools. So we focus on some of the more manageable aspects of illness. We talked about deconditioning, that's one of them. Pain, we have very good tools for manipulating and modulating pain, particularly new tools for modulating pain that is hyperalgesia or pain similar to peripheral neuropathies or other kinds of neuropathy. We have tools for sleep. It's challenging, but we can improve the quality of sleep and add some quality of life. And we actually have tools for cognitive impairment and for dysautonomias, for the autonomic aspect of illness. So we grasp on to as many aspects of illness possible and try to modulate the severity of those symptoms to improve quality of life while we're waiting for the direct treatments that go straight to the pathophysiology. So a difficult question regarding ME/CFS is this a progressive illness, and is this an illness that can be fatal? And I don't know the answer to that. Sometimes this illness can be progressive in spite of everything we do. And certainly there are cases of fatalities surrounding this illness. But many times those may be patients who did not have access to good supportive care. And I have come to feel that the secondary problems that develop around this illness are very severe and important. And they create immense morbidity and a higher chance of mortality, some of which we might be able to prevent and some maybe not. That includes what happens with deconditioning and weight gain, and all the illnesses related to weight gain, diabetes, end-stage problems related to sleep apnea and diabetes. I have patients whose main problem is now those overwhelming illnesses relating to their deconditioning and obesity, even young people. We have issues around malnutrition, and of course, the depression and despair that comes partly from situational stressors, but also from the severity of this illness and the lack of good care and immediate treatment adds severe morbidity to this illness. And that is something we can do a lot more about. So another common question I'm asked is whether this illness is contagious. So far, there have been really no studies or I don't think there's any evidence to suggest this illness is contagious per se. We often see it occurring sometimes in a familial setting, and there may be an infectious agent at some stage in this illness that could make someone sick, but in a simpler form. But right now, in its severe form, it doesn't appear to be contagious, at least not in the way we think of contagious.
Heeft u een vraag naar aanleiding van deze video? Reageer op YouTube, tweet naar @MECVS Vereniging. of mail naar wvp@me-cvsvereniging.nl. Uw vragen worden zoveel mogelijk behandeld in de chatsessies.